Tens of thousands of patients, visitors and staff have been slapped with what seems to be unfair parking tickets at hospital car parks in England last year.
Good Morning Britain has found that almost 280,000 tickets were issued across 62 hospital trusts.
Nearly 55,000 tickets were appealed.
More than 35,000 were successfully overturned and so appear to have been given out unfairly in the first place.
So should they be abolished once and for all in England? We have A&E doctor, Dr Emeka Okorocha, who believes it's unfair to charge those who park in a hospital, and business owner and lawyer Paul Britton, who says car parks won't be maintained if they're free. Now, Dr Emeka, when you look at the fact that so many people are appealing, and actually the appeals are being upheld, you know, the people who are doing the processing are saying that actually it was wrong in the first place. Isn't that telling you the people administering this are thinking, this is all ridiculous?
Then you have to ask the question, why are they administering all these parking charge notices in the first place? I mean, I've been on the end of a parking charge notice going to work. I know patients who've complained to me being on the end of parking charge notices when they've been coming in for outpatient appointments, and then people visiting family members as well who've been on the end of parking charge notices.
What circumstances of you getting fined?
So, unfortunately, I was in a position where it was a very busy car park. I was going to work. I couldn't find a parking spot.
Double yellow line.
Sorry?
Double yellow line?
Sorry?
Did you park on the double yellow line?
No, I was very much in a bay. I was parking, but you need to display the ticket. I went to handover, which we do in the mornings, where the night team hands over all the patients, and my plan was to then get a ticket after handover, run back to my car. I didn't make it in time, and I'd been fined.
Right.
So you were in a proper bay?
I was very much in a proper bay.
You focused on your work.
Exactly. I was focused on the
took you away
patients.
from the opportunity to go back.
To pay for a parking ticket, but apparently parking tickets are more important than patients.
Did you appeal?
Paul?
I did appeal.
Did it get over?
I lost it.
You lost?
I lost the appeal.
Oh, my God. You clearly weren't in Plymouth.
I mean, Paul, that very personal, albeit maybe anecdotal situation we're hearing is happening a lot.
I mean, it's a great story.
It feels patently unfair.
Yeah. It's a great story. I mean, he appealed, but, I mean, you can appeal again. It doesn't automatically follow that the tickets that were overturned because they were unlawfully issued. And that's a very different issue. I spoke to someone just this morning and they said they got their ticket overturned on compassionate grounds. So it is possible. So we can't say that they have been issued unlawfully. That's just not the right conclusion.
No, they might have been issued following the rules, as in you're supposed to pay £3 for an hour's parking. You went over that hour because of circumstances at the time you felt was beyond your control. So that was lawfully issued.
But, Kate, you know,
but it doesn't mean the broader picture is
car
fair,
parks are
does it?
very different now, where we would go to a machine, put a couple of quid in, get a ticket, display it in the car. You can pay on an app. You can extend your time on the app. There's no problem with that. You just whip your phone out and say, I need to extend my parking. There's no excuse, really.
Well, you say that, but it's very often, let's say you're taking someone to hospital for a visit, you get there, you've never downloaded that app before, there's no Wi-Fi in the car park. I'm talking from personal experience here, and you can't download the app. I'm thinking, oh, my God, I don't want to be late. I know I need to register. There are circumstances which are very pressurised, and it has to be said, in Wales and for the majority in Scotland, it is free. They make it work.
And Scotland is in chaos at the moment with free car parks. People come into the hospital, can't get a space. Ambulances can't get in and out. If there was a fire, God forbid, you wouldn't get a fire engine in and out, because what people are doing is they're taking the mickey. Everyone's parking in the free car park now, popping into Sainsbury's or Tesco's, and then coming back. I remember as a child, when car parks were free, my mum would do the same. We would park in a car park at the hospital and go into town.
The thing is, Paul, people are still jamming these car parks. Like, the issue I had was the car park was still busy. You have to understand that anyone going into hospital, especially at 8 a.m. or 7 a.m.
when she's pushed for time, what you must do is
allow
plenty of time to get to hospital in time for your appointment. If we take away the charge...
I know, but sometimes it can be an hour. You know, you think you've done time. I didn't get fined, by the way. I managed to make it work. I was just... No, I didn't get fined. I parked properly. I managed to get a way of doing it. I worked it out. But I'm just saying that there are lots of things that make it not straightforward for people under stress to do it. And in Wales and Scotland, they managed to do it. Now, if people are going into
Kate,
car
they haven't
parks...
managed to do it in Scotland and Wales, because in Scotland it is chaos at the moment.
Well, you say it's chaos for parking. I don't have any experience of parking in a hospital in Scotland, but I'll take your word for it. But if people are going to park in a hospital car park and going to Sainsbury's, as your parents used to do, go shopping in town, Surely there must be a way of stamping that and writing that off quickly. There's a way of stamping out bad behaviour, isn't there, that doesn't penalise the right behaviour?
Well, that is a long-winded process, which is going to cost money.
OK.
And if we don't charge the car parks, who's going to maintain them? Yeah, whose budget is it going to come out of? Are we going to ask the NHS processes?
In Nottingham, in Nottingham, 97% of appeals, they forget the charge. In Leeds, 94%. Mid-Yorkshire, 93%. It could mean that in Nottingham, Leeds and Mid-Yorkshire, they're particularly compassionate.
Sympathetic.
Or it could be that actually everybody's worked out, you know, if you appeal, you'll get off. Or it could be that they actually know this is a crazy way to do things.
The question, why are these people being charged in the first place? Like, during the whole pandemic, during COVID, parking was free for NHS staff.
But the country was in a state of national emergency.
But I didn't see the car parks deteriorate.
I know, but you couldn't go to the hospital either.
Yeah, but NHS
so there were less people attending the hospital.
There were less people attending the hospital in terms of visiting patients and, you know, and going for outpatient appointments. But for NHS staff, we were still going to hospital.
Yeah.
We did see any deterioration in the car parks, and they said, OK, it was compassionate because we were saving lives. That hasn't changed for the NHS staff. And that's one thing, but then the matter, obviously, is patients and patients' families who find it very difficult to get into hospital without driving. Remember, a lot of our patients are very vulnerable people. Many of them aren't very tech savvy. They can't use Ringo apps, etc., to maybe get extended parking.
And then there's public transport. You know, my parents are an hour from their hospital. My dad went in and had cancer treatment just recently. He got on the bus and went in and got the bus back again.
Well, he was able to do that. Not everybody is.
Exactly. Accessibility.
But what we can't do is have a situation where we're encouraging people to drive to the hospital and not use public transport, because it's not particularly a green way to travel.
That is a fair point, but I don't think people would do that.
You wouldn't be encouraging people to use to use their cars to go to the hospital, because we already know that it's very, very difficult to find parking.
Well, they'll say this. They'll say, let's drive because it's free to park.
Yeah, but you also have to
get on the bus with everybody else.
But you also have to think of everyone else is going to drive. Because
we've got one from Wendy on email, and this actually goes to the kind of debate between the two of you. She says, I was charged because I could not find a space when my husband was dying. Dr. Amika says she shouldn't be charged. Paul says she couldn't find a space because
it was
maybe
too
people
full.
were parking because they shouldn't be driving.
Well, look, it's a good example, but what we're looking at is how many appeals have actually successfully gone through. One of the quotes that you gave was up in the 90%. So, I mean, all she needs to do is appeal.
But that's time-consuming, costly for both the hospital and the patient.
The car parks would be chaos.
In the West London Hospitals Trust, it's 100%. Everybody who appeals gets off.
Well,
so if you are parking in West London...
So what you're doing is encouraging to appeal.
This just makes my argument, doesn't it?
No, it kind of supports my argument as to why they're being charged in the first place. Because if you made it free, we wouldn't have to go through all these appeal processes.
Because sometimes sometimes a deterrent is enough to make people actually pay.
Can I just do two comments, because we've had so many, even though your points are all brilliant. We want to hear from you too. Mona says, my father's having heart surgery next week. I'm already stressing I'm going to find parking at the hospital and how much it will cost. It shouldn't be something I'm worrying about at this point. And this other one that's not to do with finding, this is to do with actual costs. Heather says, my sister has cancer, and so far for appointments, we've had to pay £70 in hospital car parks. It's a disgrace. So she's saying that it's just too much money, because very often when people are having treatment, they can't work, they can't earn, there's other financial pressures. You can see why people are very exercised and upset about it.
It's so short-sighted to say that we shouldn't pay, because unless someone pays for it, there would be nowhere to park anyway. We wouldn't have a car park maintained with white lines, a system where you can go in and out if someone wasn't paying for it. If we're not going to pay for it at the point of use, someone has got to pay for it. So is it going to be the local authority? Is it going to be the NHS? Is it going to be local government? Because some of us will have to pay for that at some point. But the best people to pay for it are the people paying for it at the point of use. The revenue that can be collected from it can be used to improve the car park. They may even be able to collect enough to multi-storey a car park or to buy neighbouring land to get additional car parking.
Interestingly, but we don't make that argument about the use of the NHS. Exactly. So you say you should pay for your car park space, but we don't. If you need an appendix out, We don't say, well, the person who needs the appendix out should pay.
OK.
Free at the point of use,
yes.
paid for by everybody.
But if
Why
I go
is
into
car
town,
parking so different?
if I go into town to meet a funeral director to arrange a funeral, I'm going to pay for parking. You know, we're bringing the two so close together that it's blurring the lines. Yes, you're going for medical treatment, which actually is probably going to be free.
Yeah. So why shouldn't your parking be free?
Because they are not linked.
And think we deal with a lot of people with chronic conditions.
Yeah.
People who have to go to the hospital multiple times
Well, if they're
a
that
week.
bad, you know as well as I do, an ambulance will pick them up and bring them in.
I think we are proving that this is...
more pressure on ambulances.
That's actually not my experience. Should we be calling ambulances
But
then?
to bring people in? Really, Paul?
Yes, well, of
more
course they
pressure
can
on
arrange it. If there's
ambulances
plenty of time, you can arrange that. You could also have a private ambulance bring them in.
They are
There
yelling
isn't plenty
in
of time,
our
though. There
ears,
isn't.
Kate. I mean, we are proving that this is such a great debate because
It's
everybody
a huge debate.
feels really,
and also, you
really
might have
sorry.
people that can't be sitting for a long time or anything like that. Can I give a couple of rights to replies just to balance it very quickly?
All right.
The government has said that since 2022, all hospital trusts have made car parking free for blue badge holders, parents of very sick children, frequent attenders and NHS staff on night shift. The frequent attenders is not people's experience that are contacting us, but that's what they're saying. And the British Parking Association says parking operators are not out to get genuine users of hospitals, but enforcement and appropriate deterrent is required to prevent misuse of the car parks, which speaks to your point. You're going to have to both come back and carry on talking about this, because it's a fascinating debate.
We also asked our viewers, should England make free parking in NHS hospital car parks universal? 94% of you said yes. I'm really, really sorry to tell you, Paul, but only 6% of people agreed with you. Not for the first time.
Same as the
you are on the losing side.